Have you ever wondered why, despite taking your medication regularly, eating well, and having routine heart checkups, you still get short of breath, experience irregular heartbeats, or sometimes feel dizzy just from climbing a few steps? Many people over 60 keenly feel their hearts weakening, even though their test results remain within the allowable limits. It sounds paradoxical, but in my role as a health advisor to hundreds of seniors, I must say frankly, the heart needs not only medicine and rest, but must be properly nourished from within by those micronutrients your body is silently lacking. You may eat 3 full meals a day, even very healthily. But if your meals do not supply enough of those key micronutrients, abundant in youth but poorly synthesized as the body ages, then your heart is like a machine running on too little lubricant. It quietly wears down without warning noises until it truly malfunctions. Major studies over the past 10 years have shown that deficiencies of omega-3 fatty acids, vitamin D, magnesium, B-group vitamins, CoQ10, potassium, or fiber are all directly linked to heart failure, high blood pressure, stroke, and arrhythmias in older adults. The problem is, most of these nutrients cannot be replenished through an ordinary diet alone, especially when seniors' portions tend to be meager. They eat sparingly, and their digestive systems absorb nutrients less effectively with age. That is why I want to share this article, to help you understand clearly. After age 60, the heart not only needs protection from damage, but needs a boost to keep functioning robustly for many more years. And that fuel isn't anything lofty, but the 7 nutrients you can readily supplement properly if you know about them and act in time. In particular, nutrient number 5 on this list may surprise many, because it's so familiar that everyone assumes there's already enough of it. Yet in reality, it's an Achilles heel for cardiovascular health after 60. Therefore, don't take your eyes off this article. And if you care about long-term heart health, hit follow and subscribe to the channel right now. Because this isn't just an article, but could be the silent shield protecting your heart in the years to come. Now, let us begin exploring the first nutrient, a fat everyone has heard of, but few use correctly, and also the heart's most intimate friend, omega-3. There is a strange thing I've noticed in many older adults. They are very afraid of fat. The moment they hear the word fat, many immediately think of high cholesterol, stroke, and heart disease. And so they avoid all fats, including omega-3, a type of fat that, when absent, causes the heart to truly run out of steam in the literal sense. Omega-3 is unlike any other fat. It is an essential fatty acid, meaning the body cannot produce it on its own and must obtain it externally. And in particular, omega-3 is the silent guardian that helps the heart combat its most dangerous foes: high blood pressure, bad cholesterol, low-grade inflammation, and arrhythmias. Numerous international studies have confirmed supplementing with sufficient omega-3 daily significantly reduces cardiovascular mortality risk, lowers the incidence of myocardial infarction, and even prevents plaque formation in arterial walls. So why is omega-3 even more important after age 60? Because, over time, blood vessels lose their elasticity, heart rhythm becomes less stable, and endothelial inflammation intensifies, all of which omega-3 can help regulate. It acts like a delicate lubricant, keeping endothelial cells running smoothly, facilitating easy blood flow, and easing the burden on the heart with each contraction. Unfortunately, modern diets are increasingly deficient in omega-3. Fatty fish, plentiful sources like salmon, mackerel, and sardines, no longer appear regularly on older adults' menus. Many even misunderstand that fish oil raises cholesterol. In reality, it is the lack of omega-3 that allows bad cholesterol to run unchecked, blood to clot more easily, and the heart to be pushed into overwork. If you cannot eat fatty fish 2 to 3 times per week, you can still supplement omega-3 from plant sources such as flax seeds, chia seeds, walnuts, or from pure fish oil capsules, as directed by your physician. The important thing is not to ignore it, because omega-3 is not just a nutrient. It is the biological armor of the heart. After living for more than 60 years, your heart deserves the most refined and effective protection. And omega-3 is one of those gifts, small, yet immensely powerful. If omega-3 is the armor shielding the heart from external assaults, then vitamin B9, also called folic acid, is the silent defender from within, keeping the blood clean, vessel walls supple, and the flow of life unthreatened by an invisible culprit that few pay attention to: homocysteine. Homocysteine is an amino acid naturally present in the blood. It sounds harmless, but when homocysteine levels rise, a very common occurrence in older adults, it becomes the silent saboteur within the vessels, causing arterial stiffening, raising blood pressure, promoting clot formation, and posing a latent threat for stroke and myocardial infarction. And precisely at this point, vitamin B9 acts like a dedicated cleaner. It helps break down homocysteine into benign substances, thereby reducing pressure on the vessel walls and helping the cardiovascular system function more safely. Research from major universities shows that older adults who supplement adequately with vitamin B9 have significantly lower rates of stroke and heart disease compared to those who are deficient. I once worked with a 66-year-old man. His health was generally stable, but his blood pressure fluctuated wildly despite taking his medication consistently. When tested, his homocysteine level was twice the recommended amount. No one thought of this because all other indicators were normal. But after just 3 months of folic acid supplementation as prescribed, combined with eating more dark leafy greens and whole grains, his blood pressure gradually stabilized. And most importantly, he felt lighter, more alert, and experienced far fewer headaches. Unfortunately, vitamin B9 is an easily overlooked nutrient in the daily diet. Foods rich in folic acid, such as spinach, asparagus, lentils, and whole grains, are not always present in older adults' meals, especially when taste buds change, appetite diminishes, or cooking methods deplete nutrients. Therefore, if you are entering age 60 or older, or have a history of high blood pressure, high cholesterol, or mild infarction, testing your homocysteine level and supplementing with vitamin B9 is a smart and practical choice. Folic acid is not just the pregnancy vitamin many believe. It is the chemical key that keeps your heart from being strangled by its own bloodstream. And sometimes, what brings the greatest peace to the heart isn't a strong medication, but a tiny micronutrient with tremendous power from within. Have you ever felt your heart twitch for no clear reason, or noticed it beating rapidly and erratically even when lying still? In older adults, such symptoms are often attributed to old age or lack of sleep. But the truth may stem from a smaller cause than you think: magnesium deficiency. Magnesium is neither loud nor flashy, yet it plays a foundational role in hundreds of the body's biochemical reactions, especially for the heart. The heart cannot beat evenly without magnesium, because this mineral regulates the electrical activity of cardiac muscle cells, keeps heart rhythm stable, allows blood vessels to expand and contract smoothly, and maintains blood pressure within safe limits. When magnesium is deficient, you may not notice it immediately, but your heart certainly does. It must function under electrical interference, when signals passing through muscle fibers are no longer regular. The result can be a slowing or sudden speeding of the heartbeat, erratic blood pressure fluctuations, and even cramps or a feeling of shortness of breath with only light activity. Magnesium is especially important for those taking long-term medications for high blood pressure, diuretics, or cardiovascular conditions, because these drugs increase the risk of magnesium loss through urine. In other words, the more treatment you receive, the greater your deficiency if it isn't properly replenished. This is the vicious cycle that leaves many seniors taking their medications faithfully yet still struggling with unstable blood pressure, fatigue, and discomfort without a clear cause. A woman in her 70s I once met complained of frequent insomnia and strong heart palpitations at night, sometimes feeling like her heart was trembling. After ruling out other causes, we tested her micronutrient levels and found her magnesium was very low. Within just 4 weeks of mild supplementation, combined with eating more leafy greens, fish, and nuts, her sleep deepened, her heartbeat regularized, and she no longer woke up at 2 to 3 a.m. with inexplicable anxiety. Magnesium can be easily supplemented through foods: fish, seafood, dark leafy greens, beans, sesame seeds, whole seeds, and coarse grains. But as with many micronutrients, absorption decreases with age, so in some cases, taking a supplement is necessary, of course, under a physician's supervision to avoid overdose or drug interactions. After age 60, your heart needs not only rest, but also the biological conditions to continue beating in rhythm. And magnesium, a mineral that seems quiet, turns out to be the keeper of that silent beat, ensuring each heartbeat is a safe step on the journey to living well every day. There's one thing everyone thinks they have enough of, but it turns out to be desperately lacking after age 60: sunlight. Not because there's not enough sun, but because we avoid it, stay indoors more, and gradually lose the most natural source of vitamin D that nature has given us. Vitamin D has long been known for its important role in bone health. But did you know? It's also the silent warrior protecting your heart every day. Without enough vitamin D, blood vessels constrict unevenly, blood pressure rises, inflammatory responses spread, and the risk of stroke skyrockets. All because of a vitamin you thought was only needed for your joints. I once met a patient, a 68-year-old man, tall in stature but with perpetually tired eyes. He told me he was very meticulous about his diet, had regular heart checkups, and maintained stable blood pressure thanks to medication, but still always felt low on energy, with his heart pounding whenever he changed position. We ran a blood test, and the result was exactly what I expected. His vitamin D levels were nearly at rock bottom. After 3 months of guided supplementation, he not only felt healthier, but also slept more soundly, experienced more stable moods, and, most importantly, his heart talked less. Vitamin D is not merely a supplement. It's an essential hormone that affects the entire cardiovascular system, regulating blood pressure, supporting vascular elasticity, controlling inflammation, and reducing arrhythmias. When deficient, the body responds by increasing renin secretion, a substance that raises blood pressure and sets off a chain of adverse reactions for the heart. Numerous studies in the US and Europe have recorded that vitamin D deficiency increases the risk of myocardial infarction, heart failure, and stroke by up to 30 to 50%, especially in those over 60. Dietary sources of vitamin D are limited: salmon, egg yolks, fortified milk, and mushrooms. But the best natural source remains sunlight, at least 15 minutes each morning, so that the skin can convert it into active vitamin D. The problem is that older adults spend less time in the sun, their aging skin synthesizes poorly, and their diets are often lacking. So most are deficient without even realizing it. Therefore, if you've ever felt persistently fatigued, had unstable blood pressure despite medication, or experienced poor sleep without a clear cause, don't forget to think about vitamin D. Perhaps what you need isn't in the medicine cabinet, but waiting for you outside on the balcony each morning. And if you agree that vitamin D isn't just for bones, but also a close friend of your heart, press 1. If you're still not sure and need more information, don't hesitate to press 0, so we know you want to learn more. Your body deserves to be heard, and every response could help another heart that needs strength just like yours. If there is one nutrient so familiar that it is often forgotten, it is potassium. Everyone has heard of it. Some remember, eating bananas provides potassium. Others vaguely know, potassium deficiency causes cramps. But very few, even those being treated for heart disease, realize that potassium is the heart's biological pressure valve. And when this valve malfunctions, the entire system can collapse without warning. Potassium is more than just a mineral. It is the most important electrolyte for maintaining a steady heart rhythm, transmitting nerve signals, and contracting the heart muscle. In younger people, the body usually keeps potassium levels very stable. But after age 60, everything begins to change. Potassium storage capacity decreases. The kidneys, the organs that regulate potassium, function less effectively. And most dangerous of all, many of the medications older adults take daily, such as diuretics, antihypertensives, and even insulin, silently deplete potassium from the body. That means even if you do nothing wrong and eat well, you can still develop a chronic potassium deficiency. Not acutely life-threatening, but enough to throw your heart into subtle chaos. Abnormally slow beats, unexplained palpitations, profound fatigue from climbing just a few stairs, even a feeling of shortness of breath while sitting still. I once treated a 73-year-old man, otherwise healthy with no obvious heart disease, who complained of mild dizziness and irregular heartbeat every time he stood up, which then returned to normal. After extensive testing, the only abnormality was a slightly low potassium level, not low enough to trigger an alarm, but just enough to cause his heart to become intermittently unstable. We adjusted his diet, reduced his diuretic dosage, and initiated controlled potassium supplementation. Just 2 weeks later, his heartbeat stabilized, no cardiac drugs or mechanical support required, thanks to a long-forgotten mineral element. Perhaps you're thinking, so eating bananas is enough? Unfortunately, it's not. Although bananas contain potassium, the daily requirement is about 3,500 to 4,700 milligrams, while a single banana provides only around 400 milligrams. That means to meet your potassium needs, you must include plenty of leafy greens, sweet potatoes, legumes, fish, dairy, and whole grains in your diet. And for those at risk of potassium loss due to medication, regular blood tests are very important. Potassium, seemingly small, when deficient, can be the reason why the biological pacemaker inside you drifts out of rhythm day by day. And the surprise isn't in the numbers, but in the dangerous silence it causes. No pain, no fever, no cough. Just a quietly dysregulated heart in the dark, waiting for timely reinforcement. After age 60, we often talk a lot about cholesterol, blood pressure, and blood sugar, but pay little attention to the most foundational yet silent factor in our daily diet: fiber. Colorless, odorless, tasteless, offering no immediate feeling of nourishment. Yet without fiber, your heart must work twice as hard. Fiber doesn't directly build heart tissue, nor is it a vitamin or mineral, but it is the gatekeeper controlling the factors that harm your heart, such as blood lipids, bad cholesterol, post-meal blood sugar spikes, and even low-grade systemic inflammation. There are 2 types of fiber: soluble and insoluble. For cardiovascular health, soluble fiber is especially important because it acts like a biological sponge, binding excess cholesterol and removing it through the digestive tract before it can enter the bloodstream. Imagine this: when you eat a meal rich in fiber, from oats, beans, leafy greens, or whole fruits, the fiber slows sugar absorption, stabilizes insulin, and prevents bad fat from accumulating on artery walls. Conversely, if your meal is too white, consisting only of refined rice, white bread, with little vegetables, your blood sugar spikes, insulin surges, and sooner or later leads to metabolic disorders. One of the quickest paths to heart failure in older adults. I recall speaking with a 70-year-old gentleman, slender, with fairly controlled blood sugar, but persistently high blood lipids. When asked about his eating habits, he said, "I eat white rice, a few vegetables because my teeth tire easily, and I peel fruit because the skin is hard to digest." Each choice seemed reasonable, but together they left him severely fiber deficient, and his heart had to shoulder the load normally handled by his small intestine, liver, and pancreas. Experts recommend adults consume 25 to 35 g of fiber daily, yet statistics show most older adults achieve less than half of that. And that shortfall goes a long way toward explaining why lipid disorders, chronic constipation, and mild systemic inflammation are so prevalent in this age group. The great news is, adding fiber isn't difficult. Simply swap a bowl of white rice for oatmeal, eat an unpeeled apple, enjoy a bowl of leafy green soup instead of just broth, and you'll help your heart breathe easier, your blood flow more smoothly, and your blood sugar stop jolting after meals. Fiber isn't magic, but it is the soft cloth that wipes away every drop of excess fat, every molecule of cholesterol, every trace of inflammation clinging silently to your bloodstream. And after 60, when the heart isn't as robust as it once was, that simple act becomes more precious than ever. After age 60, we often talk a lot about cholesterol, blood pressure, and blood sugar, but pay little attention to the most foundational yet silent factor in our daily diet: fiber. Colorless, odorless, tasteless, offering no immediate feeling of nourishment, yet without fiber, your heart must work twice as hard. Have you ever considered that the heart also needs fuel, just like an engine needs gasoline, or a flame needs oxygen? After more than 60 years of nonstop beating, over 2.5 billion heartbeats, what your heart needs isn't just rest, nor just medication, but a form of biological fuel to keep it strong and resilient. That fuel is coenzyme Q10 or CoQ10. CoQ10 is a natural compound produced by the body, concentrated mostly in the heart, liver, and kidneys, organs that demand a high level of energy. It plays a critical role in the production of ADP, the energy molecule that powers every cell, especially heart cells, enabling them to function and recover. When CoQ10 levels are low, the heart not only becomes weaker in function, but also more vulnerable to damage from free radicals, inflammation, and reduced ability to repair itself. The problem is that CoQ10 levels naturally decline with age and drop even more rapidly if you're taking statins, a common class of cholesterol-lowering medications often prescribed after age 60. While statins are effective in reducing blood lipids, they also inhibit the body's synthesis of CoQ10. As a result, many people on statins begin to feel more fatigued, experience muscle pain, and notice a loss of strength, even if their test results still look good. I once worked with a 69-year-old woman who was taking statins after a minor heart attack. After a few months, she began to feel winded just from going grocery shopping. We found no new physical damage to her heart, but after starting CoQ10 supplementation under medical guidance, her stamina gradually returned, her muscle pain subsided, and her overall mood improved significantly. CoQ10 isn't abundant in most foods. It can be found in small amounts in salmon, liver, red meat, and broccoli, but not in sufficient quantities to offset the age-related decline. Therefore, taking CoQ10 in supplement form is often the most effective solution, especially for those on statins or with a history of cardiovascular disease. Of course, any supplementation should be discussed with a doctor to determine the right dosage and form. CoQ10 isn't a miracle cure, but it is the last bit of energy that lingers in your tired heart cells. It's the quiet spark that helps your heart beat one more time, and then one more time after that. It doesn't make noise, but when replenished, it can help your heart come back to life in a subtle yet remarkable way. And when you've already walked through more than half a lifetime, the most precious thing isn't simply living longer. It's having a heart strong enough to walk beside you for many more years, with clarity, vitality, and peace. CoQ10 may be a small part of that journey, but it's one you shouldn't overlook. We have just reviewed together the 7 essential nutrients. Omega-3, which helps the heart contract tirelessly, fights inflammation, and reduces blood lipids. Vitamin B9, which silently cleans up homocysteine, the saboteur of vessel walls. Magnesium, which keeps the heartbeat steady, never misses a beat when the body is fatigued. Vitamin D, not only for bones, but also for regulating blood pressure and reducing stroke risk. Potassium, the natural pressure-regulating valve that keeps the heart from dangerous tension. Fiber, the cholesterol gatekeeper, keeps the arteries clean and the heartbeat light. And finally, CoQ10, the bioenergy capsule that helps the aging heart avoid exhaustion. As someone who has accompanied hundreds of older adults, I've realized one thing. Many weakened hearts aren't due to age, but to a lack of proper nourishment. No one lacks these nutrients intentionally. They lack them because they don't know, because they think eating simply healthy is enough. They don't realize that when the body no longer absorbs well and the diet is too poor, the heart begins to lose these silent warriors that protect it every day. You don't need to swallow dozens of supplements. You also don't need to overhaul your diet radically. What you need, quite simply, is to start paying attention. Look at a single meal. Are there genuine vegetables? Are there seeds, beans, or fatty fish, or only refined white foods? Do you sit for a full 15 minutes each morning to welcome the sunshine, or do you avoid it as if it were harmful? We cannot reclaim our youth, but we can slow the wearing out of the heart through understanding and wise daily choices. And I'd like to ask you one thing. Have you ever changed something in your diet or supplementation to make your heart healthier? Has a small change, like adding a spoonful of chia seeds or taking a fish oil capsule in the morning, made a difference for you? If so, please share your story. You might be the very motivation someone needs to move from hesitation to action. And if you find this article helpful, for yourself, for your loved ones, or for someone you care for, please hit follow and subscribe so you won't miss our next shares. We will continue to accompany you on your journey to living well, not just living longer, through simple, easy-to-follow knowledge that truly makes a difference in later life. Because after 60, the heart needs nothing but understanding and timely reinforcement. And if you start today, your heart will thank you more than you think.